We shift our focus now to another major issue concerning India, the COVID cases. India recorded 13,216 new COVID cases and 23 deaths in the last 24 hours. Now, according to the data released by the Union Ministry of Health and Family Welfare, the number of active cases has risen to 68,108, while the daily positivity rate is at 2.73%. Now, even as the incidence of COVID continues to remain high in the capital, with 1,534 new cases in Delhi recorded on Saturday itself. Now, hospitals say that there is no need to increase the number of beds earmarked for the treatment of the infection, as hospitalizations continue to be low. Now, the number of active cases or those with current infections has shot to 5,119. However, just more than 200 people are hospitalized. And according to the daily health bulletin released by the government, what we're learning is that people infected with the earliest version of the Omicron variant of COVID, first identified in South Africa, may be vulnerable to reinfection later with versions of the Omicron, is what we're learning. Now, of course, I have my colleague Sujata Dwivedi joining us on the broadcast from Maharashtra. Sujata, now give us details about the COVID situation in Mumbai, in Maharashtra at this point. Sujata, if you can hear me?
Yes, I can.
Right. Go ahead, Sujata. Give us an outline of the situation in Maharashtra. How is it like? What are the number of cases being reported?
Yes, so 3,883 new cases in the state were recorded, and with 2 COVID-19 deaths reported in the state. And the case fatality rate in the state stands at 1.86%, and the active cases in the state. And as on today, there are 22,828 active cases. And with the upward spiral of the COVID-19 cases in Mumbai, doctors are observing a rise in the infection among young children and also adolescents. And 1 in 10 patients detected with the infection is under 20 years of age, and according to the data to the Mumbai Municipal Corporation. But unlike the second wave, the severity is less, with the majority of patients remaining asymptomatic. And also, the pediatric COVID task force is currently monitoring the growth rate, and if the schools are following the laid down COVID-19 protocols, they have also suggested forming committees at school level for the implementation of the guidelines. However, this comes at a time when Mumbai is faring one of the worst among all the 36 districts in the Maharashtra. And only 30% of the eligible children, however, between the age of 12 to 14 years have taken the jab of vaccination in Mumbai, the lowest coverage in the age group in the state. And in the age group 18 to 15 years, 58% of the children have taken the first dose of vaccine. So currently, children have resumed schools and colleges as well, as the lockdown restrictions have been eased in Mumbai, and people now are used to the new normal. Masks are mandatory, and which is why the government is focusing on new implementation of rules and guidelines in the state.
Right. Stay with us, Sujata. Let me quickly rope in Dr. Ishwar Gilara, who's joining us at this point, who's an expert in infectious diseases. Sir, thank you for joining us this morning. Now, we're talking about the spread of COVID cases once again. Now, how do you think we can mitigate another COVID wave?
See, currently, Aarti, what we are seeing is almost 100% let up of COVID cases in the country in 1 week time. So, it's 95%, 100% let up. However, if you look at the trajectory of the cases, very few require oxygen, very few require hospitalization, very few are in ICU, hardly anybody, and death rate is very low. As Sujata was saying about case fatality rate of 1.87%, that is a cumulative in the last 2.5 years.
Right.
If you look at current case fatality rate, it is 0.1%, and 0.1% is same as that of in flu. Secondly, Maharashtra, Kerala and Delhi has been always leading the show since beginning, whether it's the first wave, second wave, third wave, or possibly now fourth wave, whenever it comes. So we will be leading the show. There will be lag time of between 1 to 2 months between other states. So other states cannot lie low and saying that we will be not having a problem. However, if you take precautions are good enough for COVID, and same precaution will apply to monkeypox. We are not having any case of monkeypox, but that will come any day.
Right.
And thirdly, we should expedite the vaccination of below 18, because that is a vulnerable population, and vaccination of those children is very, very poor. Below 12, 0, and between 18 to 12, it's 26% of the children are vaccinated with 1 dose, and 12% or 13% with 2 doses in Maharashtra. So I think what we are not doing what we should have been doing, and we are just expecting that something will come up and how we should follow. We don't need to increase the hospital beds. We don't need to have any kind of concern. Generally, what we should be doing, number one, for last 5-6 months, there is no zero surveillance. After January, there is no zero surveillance I have heard of. So we should keep on doing zero surveillance. That will tell where are the pockets in the country. Number two,
Right.
genome sequencing should continue to find out whether any new variants are coming, and those are variants of concern or variant of support. And thirdly, we should expedite the vaccination program. Either it is below 60 with comorbidity, above 60 generally, and below 18.
Right, Doctor, stay with us. Let me quickly rope in my colleagues Abhijit Bhatt from Gujarat and Naveen Nishant from Delhi. Let me rope in Naveen first. Naveen, अभी बताइए जो दिल्ली में केसेस है, कोविड केसेस, उसके बारे में बताइए और डिटेल्स दीजिए. कितने कोविड केसेस राइज हुए हैं और हॉस्पिटलाइजेशन का भी डिटेल्स दीजिए.
जी देखिए, बिल्कुल बता दें कि राजधानी दिल्ली में पिछले 24 घंटे के दौरान कोरोना के 1534 नए मामले आए हैं. जो पॉजिटिविटी है वो 7% से थोड़ी ज़्यादा दर्ज की गई है. लेकिन सबसे बड़ी जो राहत की बात यह है कि जो हॉस्पिटलाइजेशन की हम बात कर रहे हैं वो काफ़ी कम है. यानी दिल्ली के जो हॉस्पिटल हैं उनमें 1% से भी कम जो मरीज हैं वो एडमिट है. यानी हम समझ सकते हैं कि जो कोरोना की सीवियरिटी है वो काफ़ी कम है. भले ही राजधानी दिल्ली में 1500 कोरोना के मामले आए हो, लेकिन हम पिछले दिन की हॉस्पिटलाइजेशन की बात करें तो मात्र 3 पेशेंट ऐसे थे जिन्हें हॉस्पिटल में एडमिट कराने की ज़रूरत पड़ी थी. इसके साथ ही आईसीयू और वेंटिलेटर की बात करें तो राजधानी दिल्ली के लगभग सभी जो कोरोना डेडिकेटेड अस्पताल हैं उनमें तमाम जो आईसीयूज़ हैं, जो वेंटिलेटर हैं, वो अभी के समय खाली हैं. और वैक्सीनेशन की बात करें राजधानी दिल्ली में तो लगभग सभी जो एडल्ट हैं जिनकी उम्र 18 साल से ज़्यादा है उनकी दोनों डोज हो चुकी है. और बड़ी तादाद में जो लोग हैं उन्होंने प्रिकॉशनरी डोज भी लगवाया है. अगर हम बच्चों की बात करें 12 से 18 साल की तो लगभग 85% बच्चों ने फर्स्ट डोज जो वैक्सीन की है वो लगवा ली है. और सरकार की कोशिश है कि जल्द से जल्द जो तमाम बच्चे हैं जो वैक्सीन के लिए एलिजिबल हैं उनके दोनों डोजेस कंप्लीट हो सके. क्योंकि राजधानी दिल्ली में पिछले एक हफ्ते के दौरान कोरोना के मामलों में वृद्धि हुई है. तो ऐसे में हेल्थ डिपार्टमेंट का भी ये कहना है कि कोरोना के मामले भले बढ़ रहे हों लेकिन चिंता करने की कोई बात नहीं है. जो तमाम सरकार द्वारा प्रिकॉशनरी मेथड है वो उठाए जा रहे हैं. जो सर्विलांस टीम है उन्हें जगह जगह डिप्लॉयड किया गया है. और सबसे बड़ी राहत की बात यह है कि कोरोना की जो सीवियरिटी है वो काफ़ी कम है. हमने पिछले साल देखा था अप्रैल मई के महीने में जब देश के तमाम हॉस्पिटल्स में ऑक्सीजन बेड की कमी हो गई थी, आईसीयूज़ की कमी हो गई थी, वेंटिलेटर की कमी हो गई थी, लोगों की मौत हो रही थी. लेकिन इस बार भले ही मामले 1500-1600 राजधानी दिल्ली में लगातार आ रहे हों, लेकिन जो हॉस्पिटलाइजेशन की दर है वो काफ़ी कम है. लोग होम आइसोलेशन में ही रह रहे हैं और ठीक हो रहे हैं. तो कहीं ना कहीं कोरोना के मामले भले ही राजधानी दिल्ली में बढ़ रहे हों लेकिन अभी के समय जो स्थिति है वो पूरी तरह से नियंत्रित है.
जी, धन्यवाद हमारे साथ जुड़ने के लिए नवीन. थैंक यू फॉर ब्रिंगिंग अस दोस डिटेल्स. लेट मी रोप इन माय कलीग अभिजीत भट्ट जॉइनिंग अस फ्रॉम गुजरात. अभिजीत जी, बताइए जो गुजरात में सिचुएशन है कोविड की उसके बारे में बताइए. नंबर ऑफ केसेस एंड द नंबर ऑफ वैक्सीनेशन एज वेल.
तो 24 घंटों में 234 केस दर्ज किए गए गुजरात में. और जिस तरह से गुजरात में 234 केस दर्ज हुए तो उसमें से सबसे ज्यादा अहमदाबाद सिटी में जो 130 केस दर्ज किए गए. और जिसके चलते राज्य सरकार भी चिंतित है क्योंकि प्रधानमंत्री नरेंद्र मोदी भी इन दिनों दौरों पे आ रहे हैं क्योंकि गुजरात का चुनाव आ रहा है. और उसको चलते राज्य सरकार के स्वास्थ्य मंत्रालय ने एक एक्शन प्लान बनाया हुआ कि जब भी कोई ऐसी बड़ी जनसभा होगी या पीएम आने वाले हो या केंद्रीय गृह मंत्री आने वाले हो, कोई वीवीआईपी नेता आने वाले हो, तो उस टाइम पे जहां पर भी जनसभा आयोजित होगी वहां पर आरटीपीसीआर टेस्ट जो स्टेज पर उनके साथ जो वीवीआईपी आने वाले उनके साथ डायस जो है वो शेयर करने वाले जो होते हैं उनका आरटीपीसीआर टेस्ट कंपलसरी होगा. साथ में वहां पे स्वास्थ्य मंत्रालय की ओर से और हॉस्पिटल्स की ओर से वहां पे सभी प्रकार की हेल्थ इंफ्रास्ट्रक्चर भी तैनात किया जाएगा. जैसे कि डॉक्टर्स है, प्राइमरी जो हेल्थ वर्कर्स है, सबको तैनात किया जाएगा. और कोई भी इमरजेंसी आ पड़ती है तो वहां पर सभी हॉस्पिटल्स को गुजरात में अलर्ट रहने के लिए बोला गया है. और कोविड के जो सेपरेट वार्ड बनाए गए थे वो भी वापस स्टार्ट कर दिए गए ताकि कोई भी मुश्किल आ पड़े तो वहां पर उनको ट्रीटमेंट दी जा सके. जी,
धन्यवाद Abhijit ji. Thank you for joining us and bringing us those details. Final word from you, Dr. Gilada. Now, of course, we've learned that vaccinations, like you said, and our reporters also mentioned that vaccinations of children has actually not increased as much as we'd expected. But apart from that, in terms of precautions, do you think people have become more complacent with in terms of masks and sanitizing?
See, we cannot blame people because 2.5 years they have been almost locked down. And therefore, expecting people to have masking and social distancing and no socialization, that is not going to happen.
Right.
And probably that is not required. If you see last 5-6 months of Omicron, it has been a variant of support. It has never been a variant of concern. Now, what we should to look at is, medical science believes in think of the worst and do your best. So think of the worst and do whatever best we can do. So when we are finding 0.1% case fatality rate, who is dying? Why they are dying? Whether that is comorbidity, and how can we reduce that? How can we provide care for that? I think we should look at also SOPs which should be changed. I have a case where somebody was an airline captain staying in a hotel, and he voluntarily said that he has been COVID positive. Hotel cannot allow him to stay because hotel has to run the business. They wanted a bed. Beds are not available in a single room. He doesn't want to be in a kind of general ward. So I think we should look at allow people to be in room wherever they want to be. You maintain whatever precautions are required. Universal precautions are good enough to even prevent HIV, COVID in hospitals. So I think we should keep on changing our SOPs. We cannot have the SOP of 2020 to be applied in 2022. Secondly, there are different committees in Government of India. There is a DCGI, Drug Control General of India, that gives a license to a particular vaccine or drug. And that is given after proper studies are done in India. After that, there is another committee called NITAGI, National Technical Advisory Group on Immunization. They keep on sitting on that recommendation for a couple of months. Thereafter, when they recommend, the Government of India has to decide whether vaccination should be done or not. Now, there are two instances where vaccination can be done between 12 to 5. And they have been already cleared at DCGI. Vaccines are available, but NITAGI has not cleared it. Number two, we mix and match vaccination. Now, if we say that there are vaccination available for Corbevax, which can be mixed with previous vaccination, that gives a 10 times more immunity. DCGI has given permission to Corbevax. It is not in the guideline. So I think there are committees which are working at cross purposes. We don't need so many committees. We should have a very sense of urgency. If something is cleared by government's one body, the other body should not take more than a week to clear that. So I think we should look at those issues, and they are more than enough currently. And we have a lot of other headaches in the country. We cannot keep on just talking COVID, COVID, COVID. There are a lot of collateral damages happening. We should look at that.
Right. Thank you, Doctor, for joining us and sharing your thoughts on this particular story.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.